The stress level inside COVID ICUs right now is unimaginable. Normally, when we talk to nurses, it's set up through the hospital, but this story started with an anonymous email I received. I am writing to you on behalf of the registered nurses at Broward Health Medical Center as a plea for help. Why are you afraid to show your face?
We're supposed to portray this healthcare hero to everyone and make it seem like we have everything under control in the ICU, and that's not the case.
Broward Health in Fort Lauderdale, Florida is one of the largest public hospital systems in the U.S., but nurses say they are overworked and critically short-staffed. Normally, one ICU nurse would care for 2 COVID patients. Now they're caring for 3 or 4.
We are in such a critically short staffing scenario that we can't properly care for the patients.
Have there ever been situations where you've wanted to do more for a patient, but you can't because you're spread so thin?
Every day. The
nurse shortage is not unique to this hospital. It's a problem nationwide.
Our care teams are tired.
Cheryl Wild is a chief nursing officer at Broward Health. She says they recognize the burden, but can't hire fast enough. Some of the nurses are telling us that, they've gone from treating 2 patients in the ICU to now double, sometimes 4, and they feel like they can't give the care necessary. Is that a concern for you?
Sure, and again, we're doing everything that we can to fill some of those holes. We've contracted with agency staff and we've initiated surge plans in order to support the teams at the bedside.
These ICU nurses say more than half of their colleagues have already quit, and the surge in COVID cases is making the shortage worse.
It is beyond stressful. Nurses feel like they are drowning. Nobody's listening to them. We're not getting the help that we need.
And you heard that chief nursing officer talk about them hiring agency nurses. These are known as travelers, nurses that come from other states to help with the staffing shortage. Sometimes they can be paid 3 or 4 times more than the regular hospital nurses, and you can imagine that really also hurts morale in the hospital. Ruta Bay.